Hi, my name is Caitlin Weidlich, and this is my Nursing 335 Summary Reflection video. The purpose of this video is to explain how I met all 8 clinical objectives for the leadership this fall. The first objective is to utilize previous knowledge of the sciences, liberal arts, information technologies, and nursing to develop skills as a nurse leader. I believe that I achieved this goal by signing up for peer leadership. First, I signed up for a Nursing 309 clinical. In the first week of clinical, it was a skills lab, and we worked on basic bed bath techniques and how to use proper body mechanics. All of the students were really nervous because it was their first couple weeks at clinical, and I really feel like I helped relieve some of their stress. And I reassured them that by the time that they're done with this clinical, they are going to be pros at bed baths and they're going to feel so much more confident. I even offered my phone number to them so that way they could reach out to me for any questions or concerns, and I was more than happy to answer any of them. I also followed that same 309 clinical group at the end of the semester for their sim lab, and it was really cool to see how far they've come in such a short amount of time. They were so much more confident in their skills, in their communications. They were easily able to answer questions and critically think in the sim lab. I also signed up for peer leadership in Nursing 311 in the vital signs lab. I got to check and monitor how well students were able to get accurate blood pressure measurements. They were also really attentive and wanted to ask a million questions, which I was more than willing to answer. I really enjoyed peer leadership, and I knew that I wanted to sign up for a lot of these experiences because I remember how much I appreciated having a senior nursing student in my junior level courses. I really wanted to be able to make a difference in the underclassmen's experience in clinical and help set them up for future success in the nursing program at Cedar Crest. Objective 2 is to apply basic principles of management to meet the challenge of an ever-changing healthcare environment. And I believe that I filled this objective by shadowing the nurse supervisor. I shadowed 2 nurse supervisors in one shift, one that was newer to the position and one that's been a nurse supervisor at Lehigh Valley for I think 4 years. The new nurse supervisor started over the summer, and she was really focusing on forming new relationships between herself and the nurses on each unit that she was managing. I believe that it was really important for her to focus on the relationships between herself and the nurses since she's been promoted to this management position. And you have to think about how she was once in those positions because she was a bedside nurse for a while, so she had to focus on maintaining and transitioning to the management position and having to worry about dealing with conflict and staffing while also communicating with people who were once her fellow coworkers. I believe it's becoming a manager or a nurse supervisor is a learning technique. You need to have time to transition into the new role, and you might make mistakes, and she was totally aware of that and knew that this was going to take her some time to get used to and feel in order to feel confident. So objective 3 is to demonstrate leadership skills through effective use of communication by representing self, the college, and nursing in a professional manner. And I believe that I achieved this objective due to the scheduling and communicating I had to do between all of the clinical sites that I shadowed. I had to email each site or professor a week in advance and explain to them why I was coming, what time, and for what purpose. I also had to schedule with my advanced practice nurse on my own behalf. I had to send him times that I was available, and we had to go back and forth, and he had to tell me when he was available until we found times that worked best for us. Then I proceeded to follow up on each experience with a thank you email, where I just further showed that I was really grateful for them to allow me to shadow this experience and how I felt it was beneficial. So objective 4 is to critically evaluate and disseminate current research related to the principle of leadership and the effects on the healthcare system. So to start off, I did a research paper on HPV vaccination. and all the ethical dilemmas that nurses might have against vaccination. So a lot of the articles that I found talked about how nurses don't strongly enforce the vaccination against HPV because they are concerned about labeling the child as sexually active, or it just makes them feel really uncomfortable. And while this may be true, nurses need to think about the ethics behind that and focus on what's most important for their patients. So one of my articles talked about the different types of authority levels that nurses use when discussing vaccines. And it was proven that a lot of the nurses used a mild to low authority level when discussing HPV because of what I said before. They were afraid of stereotyping this child as sexually active. And I also found an article that I'm going to discuss in our final. It's called Good Ethics and Moral Standing, a qualitative study of aesthetic leadership in the clinical nursing practice. And this article I found really interesting because it focuses on the nursing workforce and in two different styles. It focuses on relational or task force styles, or task focused, I apologize. The relational style focuses on the people and relationships that nurses come in contact with, and the task-focused style concentrates on completing tasks and meeting deadlines. And this article kind of goes back and forth and decides what mixture of these two styles would be the most beneficial to promote the most optimal healthcare. Objective 5 is function as a competent patient advocate, nurse advocate, and change agent. And I believe that I achieved this objective in my community outreach leadership for the flu vaccine clinic at Asbury Church. When I was there, I took blood pressures and sat down with patients who were going to get their flu vaccine. We discussed their health care and how often they go to the doctor. There was one patient that discussed concerns about their health, and when we took their blood pressure, it was through the roof. And this patient had no recollection of ever having high blood pressure, no current stress or sickness or anything that was going on that would have caused this. So we sat down with the parish nurse and discussed their options, discussed their ability to seek out health care, and I feel like I really made a difference in that person's life. Okay. Objective 6 is to formulate plans for continued personal leadership growth and development as an independent practitioner of nursing and contributing member of society. So I feel like I completed this objective during our continuing education hours for the 4 Dine and Discusses. We had a whole type of different speakers come to Dine and Discuss. We had a lady from Turning Point, and that's a place where people in abusive relationships can seek shelter so that way they can get out of the dangerous relationship that they're in. And it was really interesting to find out ways that we can help support these people in these situations. There were donation opportunities and ways that we can support their decision to seek a better life. We also had a nurse anesthetist and a pediatric oncologist speak to us, and they were really helpful in discussing ways for us to further our careers in nursing, ways that we can go back to school for different certificates or different degrees, furthering our education and pursuing specialties that we would like to do in our career as a nurse. Objective 7 is to recognize the role of the nurse in policy making related to healthcare services at local, state, national, and global levels. And I feel like this objective was completed at the Harrisburg Capitol building during Capitol Hill Day. We spent that day touring the Capitol, meeting different representatives, and listening to guest speakers. We listened to a couple different speakers who enforced the importance that nurses should vote in order to be involved in their community and to make a change that can affect their career. And to be honest, I never knew that voting could help the situation and help better the nursing career. And they said that registering to vote is the easiest way to make a difference. The speakers were also there to discuss with us the importance of the new bill that everyone is talking about, the nurse practitioners to be allowed to prescribe medications without consulting a physician. So I feel like that was a really good experience for us to broaden our horizons and see how much of a difference we can make in the nursing field. And lastly, Objective 8 is to predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice. And I believe that this objective was achieved during a situation in my nursing supervisor experience, where the nurse supervisor had to consult with family members who placed a complaint because there was an issue with the care that their loved one had received. And it was an ethical dilemma for the nurse because there was a hospital-acquired complication, and the nurse for that patient was the one that was at fault. So the nursing supervisor spoke to me about how she was really nervous, and this was the new nurse supervisor with her first complaint. She was very nervous about reprimanding this nurse because she had gone to high school with her and were actually really pretty close friends with that nurse. So in the end, the nurse had to realize, and did realize, that it was her duty as the nursing supervisor and as a patient advocate to act professional and be an advocate to this patient's health. And she actually set up a meeting with the nurse that was at fault to discuss their actions. And she had to put aside these personal feelings and relationships with that nurse in order to do her job. And I think that that's probably the best situation for her to have gone through as a new nursing supervisor, because that's probably one of the most difficult things that a manager has to deal with, especially if it's with situations with people that they like and know. Thank you for watching my video. I hope you enjoyed learning about all of my experiences this semester.